Hi there, it's Leanne. I've come back on to give you a bit of an update on my journey with Mavenclad. So I left it just over a week, I think, purely so that I could give you maybe a little bit more information as opposed to the things that I'd already mentioned in terms of symptoms and side effects of the drug. So it's been a bit of an interesting week. I guess towards the end of taking the last of the tablets, I did experience, I still had the fluctuating and I still have the fluctuating nausea and fatigue. I think there's a bit of frustration with that because I still want to do, I'm quite active. I don't like to sit around, so I don't like it when the fatigue kicks in at all. And maybe if I push myself a bit, maybe that's what flares some of the nausea, who knows. However, I do believe keeping busy is really one of the biggest tips I can give you. I have several specific MS specific Facebook groups that are receiving these videos as well. Most of them are particular to Mavenclad and they're around the world. And the feedback, I've been getting some really good feedback, some comments where people are saying that it's made a difference, the tips and tricks, and yeah, so that was the whole point of doing this, is to give back a little, because you guys out there that posted all your tips and suggestions and lessons learned, it really made a difference for me, I believe. And I think that's where a lot of us are having less side effects potentially, because we've learnt from you guys that started the drug beforehand and probably learnt the hard way, the hydration, the drinking lots and etc. So I just wanted to touch base and talk about, go back a step and talk about the last drug that I was on was Gilenya. So I had to stop that. Now I know most of you know this, however I do actually have a bit of an audience that of people that don't have MS and they are family, friends, etc. So I just wanted to give you a tidbit of information about when I was on the Mavenclad, the Gilenya, I had to stop it because it impacted, it was definitely contributing to, it was a big factor in my heart disease and the rapid progression, which my cardiologist confirmed the other day when I went. She's never seen heart disease progress so fast ever in her career. So having stopped, I had to stop the Gilenya, but before I could start the Mavenclad, and I think, don't quote me on it, I think it's the same for a lot of the drugs that people would have been on. We have to have a washout period. So the drugs, the MS immune suppressants, are there to suppress the immune system, the lymphocytes. So what we call a washout period is when you actually are drug-free. So I had a period of time where I was drug-free from immune suppressants, and that was the first time in 21 years that I'd had that. And it actually was really, really cool because I believe because my lymphocytes were coming back up, I actually had more energy. So I felt for the first time, I couldn't remember the last time I'd had more energy. I was more productive. I still had my typical symptoms, but I just had more energy and I loved it. And I was a bit naughty and I stretched out that washout period, which was a bit, could have been dangerous because with Gilenya you're high risk of rebound syndrome. They call it rebound syndrome, and that's where you can have a severe relapse. I actually contemplated not even going on another drug because it just felt it felt really good to feel like my old self from way back when. So that's what the washout period is. The washout period is about allowing your lymphocytes to come back up to normal so that you can then start the new drug. So whilst I had an awesome time, an awesome party, not being on my Gilenya, I did start to notice the inflammation that I hadn't had for a long time in my arms and hands, and it's hung around. So I can't say it's from the Mavenclad, but I think that the drug was suppressing the arthritic inflammation. So pain in my hands and fingers and arms, and my spine has been pretty full on. That's another issue, pain management altogether. There's a lot of drugs and anti-inflammatories I can't take because of my heart, etc. So just wanted to share with you what a washout period is. And so I'm post week 1, year 1. So I will go and have another round of the chemo, the Mavenclad, at the end of this month. And I'm not looking forward to that. But according to my fellow MS warriors out there, it's a few months down the track is when you really start to feel the symptoms and side effects of this drug, because the 2 doses will lower my immune system quite low and just leave minimal T and B cells. And that's so hopefully I'm going to grow some new healthy ones. So in terms of symptoms, I guess reiterate, just as I mentioned, the fluctuating nausea and fatigue, that's okay. I did have, block your ears guys, I'm sure you don't need to hear this, but I did have some pretty significant abdominal cramping, but I've since learned so did some other people. But I also, it was accompanied by pelvic bleeding, which, considering I'm 2.5 years post-menopausal, that was a bit of a surprise, one that I could have done without. In the warnings, I think it just mentions to talk to your doctor about that, so I will. I also, itchy skin. Now, we all have itchy skin, hey, at this time of the year. Everybody's dry from all the air conditioning, the heating, the clothes, the extra clothes, but really, I just can't get enough moisture into my skin. It's just a little bit over the top, driving me up the wall a bit. That's okay, I've still got lots of Nutrimetics moisturizers left in the cupboard. And also the hair thinning has started. So since you last saw me, all my curls have dropped out. Just kidding, I don't have a curl on my head, but I have had hair thinning in the top and was greeted with some more hair in the shower this morning. So I'm expecting that to, I think it's, you know, you're mentally preparing yourself. I think that when I have that next dose, I may find that may be a bit more of an issue again for me, because it's only like not quite 2 weeks since I've had the drug and I've already noticed it. I'm probably a little edgy. If I invited the family in on this video, they might say a lot more edgy, but I think just a little edgy. And I'm bruising easier, which I'm already on blood thinners. I'm on like a Cartier, an aspirin, we call it, as well as a drug called Plavix, which is very much like warfarin, so really thins your blood. And then I think with the Mavenclad on top, I've just noticed bruises in places that, you know, wouldn't normally be. The only other thing I wanted to really make a point of, I thought last time I touched on towards the end, the different environmental and stress factors that can influence how severe we experience side effects and symptoms sometimes. So for example, someone that's working, trying to keep, you know, a full-time job, who has lots of little kids, or someone that has to travel a lot, someone who's fatigued, someone who's caring for someone, financial, whatever stresses, financial, other health, you know, other people get sick too in the family. It's not all about us. Things like that. And how, you know, for example, if we're really tired and we feel a bit nauseous, that can really emphasize that. So I know I touched on that. This time I just wanted to finish with just making a point about some other factors that I believe can influence the severity of, potentially, the severity of side effects, etc. And I guess I'm referring to vitamins and other medications. And I'm pointing that out because, for example, to give you an example, you know, one person may be taking vitamin B or a range of vitamin Bs for energy or for fatigue anyway, and maybe fatigue is a significant symptom for one person, but it's not for another. So I guess if, you know, it may or may not influence if somebody's already on all the B vitamins for fatigue, maybe it minimizes their fatigue compared to the next person. Maybe it doesn't, but it's food for thought. You know, the blood thinners, like I was talking about, I'm already on blood thinners, so maybe that's where more bruising, I would bruise more than maybe the next person. Maybe antidepressants. If somebody's already on antidepressants, maybe that manages the emotional changes that one might see from the Mavenclad. Maybe it sort of masks it or reduces it or manages it a little better, as opposed to somebody else that's not on an antidepressant. So, you know, you've got all those different factors. Some people are on a multitude of vitamins, and what one person's normal MS symptom might be, you know, for example, the fatigue, as I mentioned, is, you know, potentially different for the next person. So I guess then, you know, you have this drug, and then you have those, I guess, those factors that could influence, you know, how you experience the symptoms. You know, another example for me is I'm already on a really high dose of medication for reflux, 2 meds actually. So maybe that's helped minimize some of the abdominal issues. Either way, I just wanted to leave you with, you know, those thoughts to ponder over, because I think with, you know, for those MS warriors out there on Mavenclad, it's so good having everybody to give feedback, but then we have to be careful not to compare ourselves and assume that the exact same thing is going to happen because of all those different factors. So I'm going to leave it there. I take the next round at the end of this month. I'll come back on before then. And if you've got any questions or suggestions, I'm still happy to take on any feedback. I'm sort of preparing myself for the next round, emotionally and mentally, and I think that's because of you guys and the awesome job you've done at sharing and supporting people online in all of those MS specific groups and Mavenclad groups. That's it for me. Okay, have a great remainder of the week, and I'll talk soon. Bye.